everyone, I am Lorene Gail Valencia from Section F. Today I will be discussing about rheumatic heart disease. So what is rheumatic heart disease? Rheumatic heart disease is a chronic condition caused by rheumatic fever. And rheumatic fever is an autoimmune response to group A streptococcus infection. This immune reaction causes inflammation and scarring of the heart valves, leading to valve dysfunction. Next is the prevalence and epidemiology of rheumatic heart disease. So rheumatic heart disease predominantly affects children and young adults in low and middle income countries due to a combination of socioeconomic, environmental, and healthcare related factors. So rheumatic heart disease is a significant public health issue with about 300,000 deaths annually worldwide. So patients with rheumatic heart disease often present with the following symptoms. First is fever, and then palpitations or arrhythmias such as atrial fibrillation, and occasionally coughing up blood. Another one is heart murmurs, chest pain, shortness of breath and fatigue, as well as swelling in the legs, abdomen, or hands. Let us now move on to laboratory and diagnostic tests for rheumatic heart disease. So first we have blood tests such as CBC and C-reactive protein. So complete blood count helps detect signs of infections or inflammation such as elevated white blood cell counts. And C-reactive protein measures inflammation levels in the body, which are often elevated during acute rheumatic fever or active inflammation in rheumatic heart disease. Next is echocardiography. This imaging test uses ultrasound to visualize the heart's structure and function. It helps assess the extent of valve damage such as stenosis or narrowing or regurgitation or leakage, and detects complications like heart enlargement or reduced pumping efficiency. So next is chest X-ray. It provides a visual of the heart and lungs. In rheumatic heart disease, it can show signs of heart enlargement or cardiomegaly due to chronic valve damage and increased workload on the heart. Next, we have electrocardiogram or ECG. It records the heart electrical activity to detect arrhythmias or conduction abnormalities, which are common in rheumatic heart disease due to structural heart changes. Lastly, we have throat culture, which identifies the presence of group A streptococcus bacteria in the throat, confirming a recent or ongoing streptococcal infection, which is a key trigger for rheumatic fever and subsequent rheumatic heart disease. Let us now proceed to the pathophysiology of rheumatic heart disease. So here are the non-modifiable factors in RHD. First, we have genetics, geographical conditions. Another one is socioeconomic status. And lastly, age. So first, for genetics, a family history of rheumatic fever or RHD increases susceptibility, likely due to genetic predispositions affecting immune responses to group A streptococcus or gas infections. So for geographical conditions, RHD is more prevalent in tropical and subtropical regions where gas infections are common and healthcare access is limited. Another one is the socioeconomic status. So poverty contributes to overcrowded living conditions and limited access to healthcare, increasing the risk of recurrent gas infections and progression of RHD. Then lastly, we have age. RHD primarily affects children and young adults ages 5 to 15 years old due to their higher risk of developing acute rheumatic fever or ARF after gas infections. So for modifiable factors in RHD, we have strep throat, personal hygiene, health education, healthcare access, and then living conditions. So first, for the strep throat, prompt diagnosis and treatment of gas throat infections with antibiotics can prevent acute rheumatic fever and subsequent rheumatic heart disease. And for personal hygiene, good hygiene practices such as regular hand washing reduce the spread of gas infections. Another one is health education. So raising awareness about recognizing and treating strep throat helps prevent complications leading to rheumatic heart disease. Then healthcare access, ensuring access to medical care for timely diagnosis and treatment of gas infections and acute rheumatic fever is crucial in reducing rheumatic heart disease cases. Then lastly, we have living conditions. So improving housing conditions to reduce overcrowding and enhance sanitation can lower the risk of gas transmission. Group A streptococcus or gas throat infection. So Group A streptococcus or gas is a type of bacteria that commonly causes infections like strep throat and tonsillitis. So these infections are usually spread through respiratory droplets when an infected person coughs or sneezes. So while most gas infections are mild and self-limiting, they can sometimes lead to complications if left untreated. So untreated or inadequately treated infection. So when a gas throat infection is not treated promptly or adequately with antibiotics, the bacteria can persist in the body. So inadequate treatment includes incomplete antibiotic courses or delayed diagnosis. This allows the infection to linger, increasing the risk of complications. The immune system may mount a prolonged response, setting the stage for autoimmune complications. Then, acute rheumatic fever. So acute rheumatic fever is an autoimmune reaction that occurs 2 to 4 weeks after a gas throat infection. It happens because the immune system mistakenly attacks the body tissues, particularly in the heart, joints, skin, and the central nervous system. So this misdirected immune response is thought to be triggered by molecular mimicry, where the immune system confuses the body's tissues with the bacteria due to structural similarities. So symptoms of acute rheumatic fever include fever, painful or swollen joints or arthritis, skin rash or erythema marginatum, then involuntary muscle movements or sydenham-chorea. Lastly, heart inflammation or carditis. Then for inflammatory immune response which affects heart, joints, skin, and central nervous system. During acute rheumatic fever, the immune system's inflammatory response affects multiple organs. So these are the heart, joints, skin, and central nervous system. So, for the heart, inflammation can affect all layers of the heart or pancreatitis, including the endocardium, myocardium, and pericardium. This is the most serious complication of acute rheumatic fever. Then we have joints. So, migratory arthritis or pain and swelling in different joints is common. So for skin, we have rashes or subcutaneous nodules may appear. Then lastly, for central nervous system, neurological symptoms like sydenham-chorea involve jerky, uncontrollable movements due to inflammation in the brain. Then we have heart inflammation or pancarditis. So the inflammation in acute rheumatic fever often targets the heart, leading to pancarditis. So this includes endocarditis, myocarditis, and pericarditis. So endocarditis is the inflammation of the inner lining of the heart and valves, causing valve dysfunction. Then myocarditis is the inflammation of the heart muscle, which can weaken the heart's ability to pump blood. Then for pericarditis, inflammation of the outer lining of the heart, causing chest pain and fluid buildup around the heart. So the heart valves, especially the mitral and aortic valves, are the most affected. So repeated inflammation causes permanent damage, leaving the valves thickened, scarred, and dysfunctional. Then we have scarring and damage to heart valves. Then over time, the inflammation and immune attack lead to chronic damage and scarring of the heart valves. This scarring can cause stenosis and regurgitation. So stenosis is the narrowing of the valve, restricting blood flow. Then regurgitation is the improper closure of the valve, causing blood to leak backward. So this damage impairs the heart's ability to function effectively, leading to complications such as heart failure, arrhythmias or irregular heartbeat, and increased risk of blood clots. Then we have this so-called rheumatic heart disease. So rheumatic heart disease is a chronic condition that results from permanent damage to the heart valves caused by acute rheumatic fever. It can develop years or even decades after the initial gas infection and acute rheumatic fever episode. So RHD is a leading cause of morbidity and mortality, especially in low-resource settings where access to antibiotics and healthcare may be limited. We can now proceed to the medical management of rheumatic heart disease. So once diagnosed, patients require long-term treatment to prevent complications. So penicillin injections every 3 to 4 weeks to prevent recurrent infections, and anti-inflammatory medications are administered to reduce inflammation. For pharmacological management, we have antibiotics such as benzathine penicillin G, then diuretics, ACE inhibitors, beta blockers for heart failure, then anticoagulants are prescribed for atrial fibrillation to prevent blood clots. In advanced cases of rheumatic heart disease, surgical management may be necessary. So here we have balloon mitral valvuloplasty, valve repair, another one is valve replacement, and the last one is double valve surgery. So balloon mitral valvuloplasty is a minimally invasive procedure for mitral stenosis. And the valve repair is suitable for moderate valve damage. Another one is valve replacement surgery. It is performed in severe cases where the valve cannot be repaired. Then the last one is double valve surgery. It is required when both mitral and aortic valves are damaged. For nursing management, we have regular cardiovascular monitoring, vital signs monitoring, then educate patients about antibiotic adherence and infection prevention, then provide post-operative care and emotional support, administer prescribed medications, strict bed rest, then fluid balance monitoring. Another is promote heart-healthy diet, administer prescribed analgesics, and then monitor for signs of recurrent streptococcal infection, and educate the patient on hygiene practices, as well as encouraging patient for pneumococcal and influenza vaccinations to prevent infections. And the last one is to provide supplemental oxygen as needed. The last one is the prognosis for rheumatic heart disease. So with early diagnosis and treatment, prognosis improves significantly, and severe untreated cases may lead to complications like heart failure, arrhythmias, or even death.